Hello again. I could not help but chuckle at the comment made on this morning's video by a Yoruba fellow who said, "You are a racist coffin dodger. My wife is a senior medical doctor with the NHS. I am bringing my own skills as well." Golly, that told me. Or did it? One suggestion which we will often see is that Britain has an ageing population, and it's a matter of simple economics that we should import younger people into the country to fill gaps in the workforce for which the indigenous population cannot provide. This ties in with the comment I quote that the National Health Service is short of doctors and nurses and must provide them by the mechanism of immigration. A better question might be, why are we short of doctors and nurses? Why are GPs having to add thousands each year to the numbers at their practices, resulting in longer waits for us all? What is the reason for hospital A&E departments being full to overcrowding with ambulances queuing to discharge their casualties? Would increasing immigration help reduce this problem? This sort of thing lies at the heart of the claims that an economic imperative drives immigration in this country, and that it is vital if we are to maintain our nation. Otherwise we'll run out of every type of worker, from doctors to fruit pickers. Well, since the African who commented here says that his wife is a doctor, let us stick with the NHS for a moment, which he specifically mentioned, as though he and his family's arrival in Britain would be a net benefit to the country. Why do we need doctors from abroad? In the space of a single year in Britain, that is to say between July 2018 and July 2019, the number of patients in England registered with a GP on the NHS increased by over 723,000. That is to say almost 750,000. I give a link to a source for this figure in the description to this video. I also give a link which shows how the average number of patients registered with a GP's practice in this country has risen from 7,700 in 2016 to over 9,500 today. This rise is driven by immigration and the fact that immigrant families already living here tend to have more children than the white British population. In other words, immigration will not help ease pressure on the shortage of staff in the National Health Service. It is causing the pressure. Those 723,000 new patients registered with the NHS between July 2018 and July 2019 will need another 75 GPs to care for them. That's 75 more doctors for the NHS. There's no point in promoting immigration as a wonderful way of solving the problems in the National Health Service or anywhere else. It's precisely the opposite. Mass immigration is creating the need for further immigration to fix the problems which immigration has made in the first place. The economic case for Britain needing immigration to provide staff for an ageing population is a false one, and those who try to persuade us of this ought to be ashamed of themselves. They know the figures I've given perfectly well. The rationale for the benefits of immigration is nothing more than a massive falsehood when it relates to the NHS or that sort of thing. The next time some mendacious fool mentions the ageing population or the NHS as a way of promoting immigration, then you should know at once that that person is a liar and a fraud.